The rotator cuff is a group of 4 muscles that surround the ball and help keep it seated in the socket. Its role is to keep the ball centered in the socket, while larger forces produced by the deltoid move the shoulder about a range of motion. When the rotator cuff tears, many times it can require surgery to improve pain and function. I'm going to talk to you today about rotator cuff surgery, when it's indicated, why it's indicated, and what to expect should you require surgery. Rotator cuff surgery is generally indicated when, based on your age, activity level, amount of pain, and amount of function, requires us to improve upon your pain and your function. Surgery generally involves an arthroscopic or possibly open surgery to reapproximate the torn edge of the rotator cuff back to the ball. The rotator cuff again is 4 muscles, but the most common rotator cuff muscle torn is the supraspinatus. It's the one on the top of the shoulder that attaches in this region. Predominantly in my practice, these are fixed arthroscopically. That means through tiny poke holes about the shoulder, we're able to place a camera within the shoulder, inflate the shoulder with normal saline solution, and reapproximate the tendon back to the bone utilizing anchors. Anchors are small devices that are countersunk into the bone like headless screws. They are not metallic. They do not set off alarms at the airport, but they are in a position within the bone so that they are not proud and have stitches out the top. Those stitches are then utilized to pass through the torn edge of rotator cuff tendon, so as when they're tied, they reapproximate the tendon to the bone in a tension-free manner. The indications for rotator cuff surgery generally require that the tendon not be retracted a significant amount, nor the muscle that's torn off the bone not be atrophic or withered away. If you meet this criteria and you understand the risks and benefits of the surgery, we proceed with surgery to repair that tendon back to the bone. The main goal of rotator cuff surgery is pain. Secondary to that is function. Prior to rotator cuff surgery, we generally have you see your primary care doctor for medical clearance. This generally involves a physical exam performed by your primary care doctor, as well as various labs and tests such as an EKG and chest x-ray to make sure that the anesthesiologist is comfortable proceeding with the surgery. The risks of rotator cuff surgery are the tendon not healing to the bone, small possibility of infection, possibility of need for further surgery if it does not heal, possibility of continued pain, and the possibility, as it's done under general anesthetic, of even death. The surgery is generally performed on an outpatient basis and generally either at a surgery center or a hospital. When you arrive on the day of surgery, they will place you in a gown, generally have you show up between an hour and a half and 2 hours prior to surgery. You will meet me the day of surgery, at which time I will mark the operative site. After the operative site is marked, the anesthesiologist will meet with you and talk to you about the possibility of an interscalene block. An interscalene block is where the anesthesiologist injects medicine into the top of the shoulder to numb the arm. This is much like when you fall asleep on your arm and wake up and feel like your arm is dead. It's temporary, and it generally helps a lot with not only how much narcotic the anesthesiologist has to give you while you're asleep, but also enables you to leave the hospital with little, if any, pain so that you can get home and get settled in. The surgery itself, as I stated previously, is generally performed arthroscopically through the small poke holes. You wake up with a dressing on the shoulder as well as in a simple sling. The sling is worn generally when you're out in public and sometimes when you're asleep to make sure that you keep the arm in a comfortable position. Around the house, sitting on the couch watching television, many times you can remove the sling and let the arm hang at your side. You will start stretching exercises the day after surgery. The bandages which are on the wound can generally be removed 2 days following surgery. If the wounds are dry, you can then begin showering. My normal course following surgery is passive range of motion exercises with a stick and pulley for approximately 8 to 10 weeks. Once 8 to 10 weeks have passed, we generally have had enough time for the tendon to heal to the bone. At that point in time, if you have full pain-free range of motion, we can start strengthening. General guidelines require approximately an additional 6 to 8 weeks of strengthening, with a general return to all work and/or activities of daily living approximately 4 to 6 months following surgery. Should you have further questions about rotator cuff surgery or what to expect on the day of surgery or following surgery, please feel to contact us at any time. Thank you.